Alright, I'm Charlie, and this is my client Kelly, and we will be starting off with a posterior seated posture assessment. Starting out, we'll come down here and we'll look at her feet. You can see that her feet are slightly pointed inwards. Also, you can see how her ankles are rolled out to the side. That's supination of the feet. This can cause knee problems in athletics because the knees are at a different angle there. As we go up to her hips, you can see if we palpate right here, her right side is a little bit higher than the left side, which can cause a scoliosis of the spine. Her thorax area from posterior view appears to be okay. It's not rotated either way. We'll look at scapula next. There's no winging, no abduction or adduction. Her shoulders are slightly forward. And if we look at her shoulders here, her right side is lower than the left. And then if we look at her cervical region, there's no rotation side to side, but her head is slightly tilted to the left. This can cause a lot of back problems when they get older, a lot of back pain, especially with the hips down here, lower back pain with cervical rotation or cervical tilt. That can cause a lot of neck pain. Alright, this is our lateral view seated assessment. First, we'll start out here at the knees. They're pointed inward, slight knot need or gnu varum. This can cause weakness to the inner knee joints. We'll come up and we'll look at the pelvic next. When she's seated, she has a slight posterior tilt with her pelvis as opposed to anterior when she's standing. This can cause flat back here in the lower back area. This is caused by frontal weakness and posterior strength while sitting. As we go further up her back, we can see that her thorax area and the thoracic spine, she's got a slight kyphosis, and then as we travel up into the cervical region, she's got a forward head lean. This is really common for a lot of people when they're sitting down, poor posture. Cervical head lean or forward head posture can cause neck problems. It can cause poor respiration as they get older. And this kyphosis in the thoracic region, this can cause a lot of back pain and respiratory issues as well. Posterior posture assessment down here at the feet. If we look at the feet, you can see that the feet are slightly inverted or pigeon-toed, so they're pointing towards the middle. Also, with the ankles, her feet are slightly supinated, which causes the Achilles to go in an outward direction right here. We'll travel up the midline of the calf here. Her calf muscle tone appears to be equal on both sides. There's a slight hyperextension of her knees. She's got them locked out. If we look at the creases on the back of her knees, we can see that this right side is a little bit higher than the left. The muscle tone on the hamstrings, they're about the same. Nothing wrong with that. And if we look at her hips right here, if we look at the buttock crease, the one on the right side is a little bit higher. So if we palpate right here, we can see that the PSIS is right here, higher on this side, which can cause the scoliosis of the spine, and that can lead to lower back problems. Also, if we go back down to the knees, you can see that there's a slight gnu varum or knot knees right here, pushing inward. This can cause weakness on the middle of the knee area, which can be problematic in athletics. Alright, so as we travel up from her pelvic area, we're going to start looking at the thoracic spine. Because her pelvic area is slightly higher on the right, again, this is causing the scoliosis, which is also putting a slight arch in her thoracic spinal area. It doesn't appear that there's any signs of rotation in there. We'll also look at the arms while we're looking at this before we go to the shoulders. The hands are pronated naturally. As we go up, her elbows may be slightly flexed. Her elbow on this right side is slightly lower than the other. and that's because her right shoulder is slightly lower than her left shoulder. And this can be caused because her dominant hand is her right hand. She puts a lot of heavy stuff in that hand, weighs her down, and that can cause that natural posture position. We'll also look at the shoulder blades here. Her scapula, there appears to be no scapular winging in there. There's no abduction, adduction of them. There may be a slight downward rotation of the scapula as I palpate it. We can then look at her neck, her cervical neck. There's no rotation from side to side, but you can see a slight left head tilt, which if this becomes a habit, it can cause the eyes to realign so they can be straight, which can also cause the shoulder to be down as the body tries to make itself focus in a straight direction, which can cause a kinetic chain of events all the way down the spine, including that hip raise down there. The scoliosis, that can cause pain in the back. Her shoulder tilt, which is adding to that scoliosis, all this is just going to cause back pain as she goes on later into life if it's not corrected. Alright, so next we're going to do our lateral assessment. Again, we'll start down at the feet. Here you can tell that the foot is slightly supinated, so her ankles are pointing outwards. As we travel up the midline, calf muscles seem strong. You can tell right here with her knee how it divots in right here, that her knee is hyperextended. It's locked out and pushed backwards. Continue to travel up. You can start to see in this area her pelvis is tilted forward, and that's further strengthened by her back going in a curve like this. So we got a little bit of anterior pelvic tilt in there. You can see the abs, or the abdominal area, is poking out. This means that her abs are weaker and her quads here are strong, pulling the pelvic area down. We'll continue to travel up the spine here. You can see her shoulders are slightly pushed forward, and as we go into the cervical area, her head is slightly leaned forward. That's forward head lean. These issues in the forward head lean, that can cause a lot of weight to be put on your cervical spine in your neck area, and that can cause headaches, that can cause respiratory issues. That also is a cause for that pelvic area to tilt forward to compensate for the body leaning forward on the upper part. Again, this causes respiratory issues, and it can also cause low back pain. And that anterior pelvic tilt can cause weak ligaments in the knees, which can cause the ACL to tear easier, and it's not good for athletes. Now we're going to assess the anterior view, starting down at the feet. Her feet are, they look forward, but they have a slight inversion, so they're pointing towards the middle. Again, pigeon toe, this is a better view than the posterior view. You can see how right there the ankles are tending to lean to the outside, so we got a supination in the ankle there. As we travel up, again, you can see how the knees are pushed down. We got hyperextension there in the legs. Travel further up, the musculature looks even from side to side. Go back up to the hips. We can see that the right side is higher than the left side. And also we can see from the frontal view how that lumbar area is poking out with our anterior pelvic tilt. She tends to take a wide stance. Again, she says that gnu varum, the not knees, inversion of the knees, and the anterior pelvic tilt again can cause weakness in your ligaments in your knees, as well as the hyperextension of the knees, which is putting more force on the front part of the knees, which causes a lot of wear and tear, especially if you're participating in activities such as sports. Alright, as we travel up the midsection here, again we can see that anterior pelvic tilt, which is causing a lot of her weight to be forward on her body. The chest appears to be natural. There's no deficiencies in whether one side leans to the other, but as we do get to the shoulders, you can see that that right side is lower. The clavicle appears to be in line. The muscle tone on both sides appears to be equal. We can see that as we go into her elbow region, it's slightly flexed. Again, her hands are pronated as she stands. We would like a little bit more extension in those elbows. As we travel up the head, you can see that her head is slightly tilted to the left. There's no cervical rotation. Her facial features appear to be in line, other than that tilt to the left, and that again can be the cause of leaning of the body parts on that kinetic chain. That forward shoulder can cause wear and tear in the shoulder joints, making them weaker as people age. The anterior pelvic tilt, that can cause low back pain, that can cause weakness in the knee ligaments. Alright, so everyone's got anatomical issues with their body. No one's perfect. Everyone has anterior pelvic tilt. It's not like people have their shoulders lean. It's not out of the question. The thing is, we need to fix the ones that we can that are going to cause the worst problems. And maybe if we fix one problem like head tilt, it can kinetically, on that kinetic chain, fix the other problems. Kelly, do you understand everything we're going through today?
Yes.